health and wellness class. We're going to be talking about auto accidents. We're going to also be talking about scoliosis. And those two things are very intimately involved because they both have a lot to do with the upper neck. And so we're going to be talking a lot about that today. And on our website, we have a quiz that you guys can take. You'll see patient quiz there under community services. And if you take that quiz and get 10 out of 10, you get a free ice pack. So there are 10 very important questions, and after you take the orientation, you should be able to answer them. And just when you're done with the quiz, just screenshot the quiz or cut and paste the results and send it to us, and then we'll know that you got the 10 out of 10. Our office is very unique. One, I'm a graduate of the Palmer College of Chiropractic in Davenport, Iowa. There's not a lot of us around anymore in Florida. And I'm also a diplomat of the American Chiropractic Neurology Board. So that's a specialty within chiropractic where we study the brain, spinal cord, and nerves. And if we're able to help somebody, we can do it holistically without drugs and surgery. In 2015, I became certified in clear scoliosis method. And then in 2016, I became intensive care certified. That means people would come from other states and countries and stay here for 2 weeks to get their curve worked on. And then they go home and continue doing their exercises. And then they would come back, 3 or 6 months later for me to evaluate how they're doing. And then in 2017, we became a Scoli brace provider, and that's a specialized brace that we'll review in a minute, but it's the latest technology in improving scoliosis with bracing. First thing we're going to talk about is overall health. What do you think the USA is ranked today in overall health? There's about 200 countries in the world. Any guesses? 37th. Would you agree we should be a lot higher than that? That's pretty low. We should be at the top, right? What do you think we're ranked in the world in infant mortality? Now we have really good emergency medicine here, so people think that we should be at the top there too. But birth is already something that's perfect, and if you try to improve on perfection, sometimes you don't make it as good, right? So Governor DeSantis just sent out a thing about cesareans. And it's really interesting because a lot of places, pockets of the United States or in the world even, have a very high cesarean rate. Meaning there's some oil countries that the women just don't have vaginal births. Everybody's born cesarean. And there's also sections of the United States that are like that. Well, a good healthcare system should not have a cesarean rate above a certain number, because women are not meant to have cesareans. They're meant to have a natural childbirth. And so they actually came out with a number that if you have an efficient healthcare system, I think it was 26% or something, your cesarean rate should be below 26%. There's some areas in the United States where the cesarean rate is over 50%. There's some oil countries in the Middle East that the cesarean rate is 100%. So that is not the kind of healthcare that we're striving for, but it could end up causing more issues than it's helping. So the infant mortality rate, we're 52nd. Over 1 million mothers, daughters, fathers, sons will die from heart disease and cancer this year. Would you agree we need to make some major changes in the way we approach our health? Obviously, we're not doing something right if we don't rank at the top. So there's 5 attitudes that prevent us from being healthy. 1, it's out of my control. 2, it's normal to get sick. 3, disease makes us sick. Only see the doctor when you're sick. 5, it's expensive to be healthy. These 5 attitudes prevent us from being healthy. First attitude is my health is out of my control. Genetics are responsible for less than 1% of all disease. So we can't blame it on our parents. We have to take responsibility. Health is simply the result of healthy habits. What you do every day determines whether you're healthy or not. Are drugs the answer to any of these problems? Well, the United States consumes more drugs than any country in the world, yet we're ranked 37th. So if drugs were the answer, we would be ranked number 1. So we know drugs aren't the answer. Matter of fact, all drugs cause side effects. So many times when you take one drug, it'll cause a side effect, then you need a drug for that side effect. So people can end up on a lot of drugs. Prevention versus crisis. If you buy a car, drive it as hard as you can, never change the oil, never do any maintenance, eventually that car will blow up. If it blows up in front of a new car dealership, you can just walk out of the blown up car and get into a new one and drive off, right? But you can't do that with your body. You have to practice prevention. What are symptoms? Symptoms are the result of the body being out of balance and alerting you to a problem within. Symptoms serve as a warning that something needs to be explored and changed in one's life. Illness is a message. Dennis Jaffe, PhD. So if the fire alarm goes off, you wouldn't cut the wire to the fire alarm. You'd find out why the fire alarm is going off. Second, it's normal to get sick. Well, it's normal to be healthy. But we're going to talk about symptoms in a little bit. And what some people think about as sickness can actually be health. Is it the seed or the soil? Well, the seed is your genetic potential. The soil is what the environment produced out of that seed. So which one is more important? I think the soil is, because there's plenty of people that didn't have great genetics when they started, but they made themselves into a great person and had a great life. And there's plenty of people that had great genetics that didn't make much of themselves. Third attitude, disease makes us sick. Hippocrates talked about health is ease, and then when we move away from ease, then it's disease. So that's with the hyphen, means your body's not working right, but you don't have symptoms yet. And then when we take out the hyphen, that's like a full-blown medical disease that you can see with a microscope, things like that. We spend billions of dollars a year studying disease and virtually nothing on health. So if we focus on disease, then we're going to end up with disease. Mother Teresa was asked to speak at an anti-war rally, and she declined, and everybody was upset about it. How come you can't speak at an anti-war rally? She said, well, if you have a pro-peace rally, I'll speak at that one. How life begins. 2 weeks after fertilization, the primitive streak is created. This will become the central nervous system, the master system, controlling every other cell, tissue, and organ in the body. So we first produce this spinal cord, and then everything grows off of that. In utero, we have this fetal curve and the amniotic fluid, and that protects the baby if the mother falls or something like that. And when the baby's born, you want to maintain that fetal curve. Actually, Frederick Laboure, a French OBGYN, wrote a book called Birth Without Violence, and he talked about how you don't want to just lay a baby flat on his back, because you'll take that curve out that he's had in his body for 9 months. And now we know that scoliosis patients, you want to preserve this posterior curve here, and that if you have a loss of this, your odds of having a large scoliosis curve go way up. When you're born at 3 to 6 months, you want to do tummy time. That's when you develop that cervical curve in your neck. And then from 6 to 12 months, you develop the forward lumbar curve. And then those 3 curves give you strength and stability in your spine. If you don't have those, either they didn't develop here, or you had some kind of accident which caused them to be lost. Defense against germs, there's no magic bullet, instant gratification, or miracle cure against viruses or bacteria. There's only increased internal resistance from hard work, nutrition, exercise, rest, positive mental attitude, and chiropractic care. The central nervous system controls the 5 systems in the human body: the glandular system, elimination, digestive, musculoskeletal, circulatory, and the elimination system. So the brain sends the signals down the spinal cord, out the nerves, to control and coordinate every cell, tissue, and organ in the body. Gray's Anatomy states the central nervous system controls and coordinates every cell, tissue, and organ in the body. Your body's 98% new every year. So do you guys still have to get your hair cut? Do you still get your fingernails clipped or manicured? Because your body's still growing. It's pushing out new cells. So even a spur on an x-ray is not the same spur that was there 3 years before. If you have cancer longer than 3 to 7 years, those cancer cells aren't the same ones that were there before. They were reproduced, right? So as your body's regenerating, we want new healthy cells to come in and the old ones to go away. Guidance physiology states the autonomic nervous system is the major system controlling the mechanism of homeostasis. Homeostasis is your body's ability to adapt to the environment. So if you have a fever, is that good or bad? Well, it's good because if you have an infection and your body raises that temperature, that's what your body's designed to do, to kill that infection, right? If you go get some oysters and you eat a bad oyster and you throw up, is that good or bad? That's good. You don't want that rotten oyster in your stomach. It'll cause all kinds of health problems. So your body wants to get rid of it, right? That's what homeostasis is, your body's ability to adapt to the environment. Subluxation, we see the word silent degeneration here, and if you want to get 100 on the quiz, I would remember this. 90% of your nervous system controls and coordinates all your bodily functions. Only 10% has to do with pain. So you can have a lot of misalignment for a long time without feeling any symptoms, and we call that silent decay. Your body's like a garden with proper raw materials and no interference. You will regenerate and be healthy. Healing takes time. So this is showing the spinal cord is like a hose. The sprinkler is like your nerves, and then the roses are like your organs. If you take the rock and you put it on the hose, then that water is not going to flow and the organs or the flowers are going to die. If you take the rock off the hose, it's going to allow your body to regenerate and heal. Subluxations distort the structure of the spine, reducing and eliminating curves, therefore altering the biomechanics of the spine. Research shows when this happens, you create a degenerative process that always go to completion. So these normal curves from the side of your spine, they give your spine strength and flexibility. If you don't have them, then your spine will degenerate. It's just a matter of time. This is a famous study they did called the Windsor autopsies, and they found that everybody had some pinched nerves. Wherever those pinched nerves go, those organs don't function as well. The more degeneration you have in the spine around that nerve root, the more degeneration you have at that organ. So if we find that you have subluxation, it's important to get adjusted, allowing the body to regenerate and heal. Why do you go to a chiropractor? To get adjusted, correcting and preventing subluxations. This patient came in the office when they were 52 years old, and they had neck pain, shoulder pain, mid-back pain, low back pain, pain and numbness, tingling down the left arm, depression, migraines, high blood pressure, anxiety, insomnia, tinnitus, and acid reflux. Work had become difficult. They no longer can hike or walk due to pain. Their rate quality of life is 3 out of 10. And medication, they're on pain medication and blood pressure medication. They recently received their first chiropractic adjustment at age 52 after this x-ray was taken. You can see their head is severely forward. They have a reversal of the normal curve, disc degeneration, bone spurs. That pressure on the spinal cord contributes to all those symptoms that they're having. This is a healthy spine. The person has no pain or conditions, works pain-free, walks 2 miles every day pain-free, rates quality of life is 10 out of 10. They're on no medications. They do take chlorella, which is a compressed algae that has all your vitamins, minerals, and protein. And they went through corrective chiropractic care at age 26, and they've had a monthly maintenance adjustment ever since then, and they're 55. So they're 3 years older than the previous patient, yet they don't have any degeneration. So the head's half as far forward, they have the proper curve in the neck, no disc degeneration, no bone spurs, spinal cord is relaxed, and they don't have any symptoms. So wherever you are, you don't want to work toward that healthier spine. This patient came in with severe migraines, 12-year-old girl. She under the care of a medical neurologist at one of the large hospitals in Jacksonville, and their answer for her was migraine medication. She was missing school. Even though she was on the medication, she still got migraines. So when she came in, I noticed that her head is very far forward. These two bones are supposed to be parallel, so you can see how they converge there. There's a lot of pressure here. Complete reversal of the spinal curve, and so this was all being stretched. She went through corrective care in our office, and 2 months later, you can see the top two bones in the neck are parallel. Forward is the head was reduced, and she now has a forward curve in her neck. She stopped having the migraines, was able to go to the school without medication. So this really changed her life coming in here. If she would have just continued with the care she was receiving, she would have just been known as the migraine patient and would have continued on those medications. They would have ended up causing side effects and a lot of other health problems. This patient, at 9 years old, was discovered she had scoliosis. We started working on her. It reduced from 22 degrees to 16 degrees and then 10 degrees. And the thing that's neat about this case is you can see how the upper neck corrected as that spine corrected. And that's where we consider the cause of things. And we're going to show you one later that looks just like this, caused by a car accident. And so this is when she had the 22-degree curve, 16-degree curve, 10-degree curve. So the upper neck is the control center that when that's out of alignment can cause scoliosis. This is an adult patient that came in and her curve was reduced from 24/12 to 13/9. So almost no longer had the scoliosis. This is another patient around 12. I was telling you, she got into a severe car accident. You can see how the head was way out of alignment after the car accident. Her leg length and posture improved pretty quickly after the accident, within 3 days. So then we did a follow-up x-ray, and after 3 adjustments, she had a really nice correction. So the younger you are, the easier it is to correct these misalignments. This is an x-ray from the side of the spine looking this way, and the patient had a posture like this. And we see this a lot in younger kids now. So when I was in chiropractic school, we would never see an x-ray like that. But with the gaming, kids being more sedentary on their phone, they're getting into this fetal position, and so we're going to have a lot more neurogenic diseases because of this. And this is after a month of corrective care. You can see that curve was restored, and so we made a big difference in that child's life. This patient is daughter of a medical doctor in South Carolina who heard about us, and she came down for corrective care, also got a brace, and this is her 6-month follow-up, and she actually reduced her curve down to the point where she no longer had the 10-degree curve, so she actually had completely resolved the scoliosis. This is another patient came in, similar case of a 25 to 30 degree curve, reducing down below 10 degrees, so he no longer has scoliosis. The care in the office we call mix, fix, set. Mix is a warming up of your spine to get it more pliable to correct back to normal. Fix is the specific adjustment, and then set are is the scoliosis traction chair and the exercises we do to hold everything in alignment. Now, if you have been in an accident, we wanted things to settle down a little bit before we do the corrective exercises, but that is something we do with accident cases too, so we can get things as close to normal as we can so the problem just doesn't come back again. Scoli brace is an overcorrective or supercorrective brace. So if your scoliosis has you like this, the brace is going to put you in this position. It's a mirror image, but it actually does it three-dimensionally. So it's not just from the front view. So the old Milwaukee brace was just a three-point brace, and so it was squeezing your spine, really hoping that it didn't get worse. But it actually created a more rib rotation, which could make the curve worse, and you couldn't move in it, so it would cause atrophy. So what they found was if you went to a school screening and you were positive for scoliosis but less than 40 degrees, they put you in the Milwaukee brace. But what they found after a few decades of doing that is they found that the kids that tested positive at the school screening and got the brace actually had more likelihood of getting scoliosis surgery than if somebody never got screened. So then a couple things happened. One, they stopped doing scoliosis screenings, and then they stopped doing the bracing. They just went straight to surgery. And so that was the state of things for quite a while. And they tried to come up with some different braces, but they just were not very effective in preventing surgery. And in the last 10 years, they've come up with what we call a 3D mirror image brace. And statistically, it actually reduces the curve down more than it makes the curve worse. And it also is effective in adults, which is something that they were unaware of before. So to make the brace, we do a 3D structural scan of the body, so it creates a hologram of the body. Then we send that to Australia with the posture pictures and x-rays, and it creates the 3D overcorrective brace. It Velcros on the front so you can put it on yourself. Most of the medical bracing, the Milwaukee, the Boston brace, Velcros in the back so that it's hard for the patient to put it on themselves. There's air holes for ventilation because it gets hot in Florida. So you can move in the direction of the correction, but not in the direction that makes it worse. It exercises your spine when you're moving in it, and that prevents atrophy. So this patient had a left translation with her curve. The Scoli brace brings her to the right. So this is her out of the brace now. And then this is a 12-month follow-up where you can see she held the correction. Now when you're an adolescent, we expect to get more dramatic results. This patient went from 33 degrees to 11 to 6 degrees over 22 months. This is an adult in the brace. This is a 64-degree curve out of the brace. In the brace, it goes down to 39 degrees. So it's not that it's going to completely get rid of the scoliosis, but the patient feels better, and it helps to reduce and control the curve, preventing it from getting worse. As somebody gets older, they can have degenerative scoliosis, and the brace helps to stabilize that and keeps function at a high level. People that are in their 70s, 80s, 90s, when they wear the brace, they may be able to do things that they couldn't do without it. Cooking, washing the dishes, making the bed, things like that, where they got into a very painful state with the scoliosis. The adult brace is a little bit lower cut down if it's a primary lumbar curve, meaning they didn't have scoliosis as a kid, and all of a sudden they got this degenerative lumbar curve. So on those cases, this is what it looks like. With an adult that just has advancing adolescent scoliosis, the brace is a little bit higher up. Waiting is dangerous. So there's side effects to surgery, okay? So when you look at the research of scoliosis, the surgeons will say it's not a question of if the hardware will fail, it's a matter of will the person live long enough. You know, if you get into a car accident, these things can break. Screws can come out, rods can break, screws can break. And then sometimes the screws just slip and come out. So a lot of potential risk with getting the surgery. So we want to do everything we can to prevent surgery. Now, if we find that we think somebody needs surgery, we'll refer them for it. For children, we recommend Philadelphia Shriners Hospital. And for adults, we recommend Dr. Lindke at New York Columbia Presbyterian Hospital for for those kind of specialized cases. How do you get a subluxation? Overwhelming stress, accidents, and toxins. So stress can pull the spine out of alignment. So if we think about an electric panel, right, you have all the breakers, and if you get the hair dryer going with the blender and the dryer all going at the same time, click, right? So your spine's the same way. If it's under a tremendous amount of stress, it'll flip out of alignment. If we get into a car accident, the car gets a fax report, right? And you can never sell that car for what you could have sold it if it wasn't in the accident. Your body's the same way. So when we get into an accident, things get out of alignment, ligaments get damaged. We want to get the spine as close to normal as we can, but we can never eliminate the fact that there was an accident, okay? And then toxins, medication and toxins in foods, the environment, they can cause the liver and the kidney to work really hard, and that can pull things out of alignment in your spine. So those are the ways people get out of alignment. The original subluxation. So this is a picture taken from a video by the Department of Navy teaching doctors how to deliver babies. Does anybody notice anything in this picture? The head's being pulled, right, can very easily get things out of alignment here, right? So how do we get these upper necks out of alignment? It can be birth trauma, can be a car accident, and then if it's not a normal birth, which they're calling this a normal birth, then they have to use forceps, even more chance of damaging the neck. So if somebody says, yeah, I had a vaginal birth, unless they were giving the body time for it to happen naturally, when the apple's ripe, it'll fall from the tree. If they're forcing it, they can cause damage, even though there's no cesarean or things like that. The cause of all disease is your body's inability to regenerate. Balance equals health. When you're in balance physically, chemically, and emotionally, you will be healthy. Fourth attitude, only go to the doctor when you're sick and you better have insurance. Better to go to the doctor when you're healthy and then you won't need insurance. Fifth attitude, it costs money to stay healthy. True, however, it costs a lot more money to be sick. 50% of all bankruptcies are caused by medical bills. Prevention makes more sense. Take care of your incredible body. So the worst case scenario is you can't work and you have accumulating medical bills, right? So we don't want fear to be a motivator, but the potential of that happening should motivate you to make good decisions. So you're eating right, exercising, keeping up with your chiropractic appointments. So then you'll smile like this guy. In the state of Florida, we have an unusual car insurance law. It's called no-fault insurance. Most states don't have no-fault, but we do. So if you get into an accident, there's a requirement to get to the doctor within 2 weeks, and that doctor must document that you have what's called an emergency medical condition. And if they don't, then the PIP auto insurance does not have to pay for your medical bills. So it's very important. Now, you can have some unusual symptoms from an accident that you might not relate to a car accident. And they can be nausea, dizziness, jaw trouble, difficulty concentrating, insomnia, changes in vision, lightheadedness. All these things can happen from an accident. Well, they sound like a lot of different weird symptoms, right? Well, because your neck, your very upper neck, the top bone in your neck, controls your brain. 90% of your brain is linked into this very upper neck. And so accidents can very commonly get that out of alignment. So if you get into an accident, make sure you get checked within 2 weeks and they document it correctly. There's 3 phases of chiropractic care. The first phase is what we call relief care. It's very important that you get feeling better. If you're not feeling better, you're not going to be happy, and we're not going to be happy either. The second phase is what we call corrective care. We want to get the spine in the closest normal position we can to keep you healthy. And then the last phase is preventative care. We talked about in the orientation, 90% of your nerves control your bodily function, only 10% causes pain. So if we're only listening to pain to tell you when to go to the chiropractor, a lot of negative things can happen in the meantime. So if you come in and we check your posture, we do a leg check, we see things that need to be adjusted, we take care of it when you don't have pain. So depending what your stress level is, that would be getting checked once a week to once a month. The neck bone. Most people are sleeping in a position that's going to cause trouble for the neck. So the neck bone allows you to sleep, putting the curve in your neck, and then your head's all the way back to the bed. And that's going to keep the head over the shoulders, the curve in the neck. And you can train yourself into sleeping that. And that way, and it's much better. Now the lower back, if you have too much forward curve or a spondylo, then keeping the back flat is better. If you have a reversal of the lumbar curve, then you want to put a roll here. I'm using prism glasses here, so I'm looking this way, but I'm seeing this way. So they allow you to read in bed, watch TV in bed, use a device, so you're not hurting your neck. An ounce of prevention is worth a pound of cure, Benjamin Franklin. This little guy came in with infantile torticollis. So when he came in, his head was like this, turned like this. The doctors wanted to come in and cut this muscle to balance things out. And the mother decided to come in here for us to work on him. Within a few weeks, his head position was normal. And you can see him, this is doing the tummy time that we talked about. So he's developing that cervical curve. And you can see the mom's happy with the result. This patient has had 6 kids, I believe, and she was a patient with each pregnancy, and then brought the newborns in to get checked right after they were born. Because even a natural childbirth, in which all her babies were born at home with the midwife, it's still the most violent thing that we will ever go through. It's done like that purposely to stimulate your nervous system, meaning it's time for the baby to breathe on its own, nurse, go to the bathroom. So it's a click on causing some pressure up in that upper neck to activate the nervous system, but it can also be traumatic. So it's important to get that checked right after the baby is born. And the mother, the chiropractic care, they've shown that the labor time is reduced, the deliveries are less painful, more likely to have a natural birth if they're under chiropractic care, more likely to be having milk let down. And so then you have the milk letting down, the baby's functioning at a point where they can nurse, and you know it's very important to get off on that right step when they start. What is science-based nutrition and how does it work? It is a system we utilize to check for vitamin and mineral deficiencies. We do blood, hair, and urine analysis, and it creates a very specific report. We review your vital signs, any health problems that you're having, any medications that you're on, and then the blood work in urine and hair gives us a list of potential health problems that you may have. Metal toxicity, if you've worked around metal or had old pipes or used a well, dental work, some people may have metal toxicity. It's important to know that you have it or not. It can really affect your health. And then this is a more in-depth panel than you would get at a normal physical. It shows all your vitamins and minerals versus just a handful. And just until recently with COVID, most doctors weren't even checking for vitamin D. But since we found a direct link to your vitamin D level and your survivability of COVID, now most people get their vitamin D level checked when they had a physical. And that really got me excited about nutrition when I found that out. The first people that got COVID in China, if they had a low vitamin D level, most of them died. The ones that had a high vitamin D level walked out of the hospital. And when I saw that relationship and how conclusive it was, I was really amazed. And so that's why when you go to a GP now, they almost always check the vitamin D level because they found that link. And in holistic healthcare, you want that level up around 70 to 100. The medical level normal, or bottom of the normal range is like 25. So even if you go to a medical doctor and they tell you it's 30, it's good, it really should be higher than that. And then it gives you a specific list of recommendations. After taking the supplements for a few months, then you review the labs, make sure things are improved, and then the goal is that you're only taking what you need to take, and it's a smaller amount. When you find that we've helped you, if you let other people know, we'd appreciate it. That's how most people find out about us. Any questions at all? No? Okay, and then remember to take the quiz on the website, copy the results, and we'll be excited to see that you made 100, all right? So January 3rd, 2023, this has been Dr. Jay Hartley from Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. All right.